Okay, so first we're going to work on the shoulder. I'm going to do a joint mow, but that's going to help to improve shoulder flexion. First thing on any joint mow I want to do is I want to start with a little bit of distraction. So I'm going to get in good body mechanics here. So I want a wide base. This is a really low table. I'm going to kind of grab around her shoulder joint. So my top hand is coming just off, just inferior to the acromion. My bottom hand is kind of encapsulating her axillary area underneath her arm. And all I'm going to do is I'm going to take up the slack in the tissue by kind of squeezing, and I'm just going to unweight really gently the shoulder. So my force is going back this way, completely laterally. I'm just taking the shoulder joint and slowly putting a little bit of stretch on the capsule. Okay, so I'll start with that. I'll probably do that. We'll do that about 30 seconds or so. Then I'm going to do the joint load. So I'm getting my patient completely relaxed. My body mechanics, my inside leg is forward, my outside leg is back. My hand, I have the palm just on the acromion, and my thenar eminence is just right at the proximal humerus. Little bit of distraction, and then a grade 1 looks like this. Again, I like to think of it as bending a fly's knees, not very much movement at all. Grade 1s are to help decrease pain. Key on all these joint moves is my tempo. I want to go nice and slow. Okay, now I'm going to go a little bit more. This will be a grade 2. So I'm going about halfway through that range. Then I'm going to do a grade 3, which is very large oscillations all the way through the range. Then I'm going to do a grade 4, which means I'm going to go all the way to the end, hang out there, and then just do small oscillations right at the very end. All those are to work on improving shoulder flexion. Okay.